Good afternoon, Miss Kirby and fellow students. Welcome to my presentation of Fibrodysplasia Ossificans Progressiva. Fibrodysplasia Ossificans Progressiva, also known as FOP, is one of the world's most obscure genetic diseases known to mankind, with only 800 cases confirmed around the world. Put simply, FOP is a genetic disease that causes the body tissues, ligaments, tendons, and muscles to turn into solidified bone. As the disease progresses, the person will become paralyzed as a result of their body's inability to move the joints. The final result of this disease is death, which is most often resulted from the person's inability to effectively breathe, as the muscles around the ribs, the intercostal spaces, and diaphragm harden into bone. The person loses ability to breathe or cough effectively, which exposes the person to pneumonia and other respiratory illnesses, leading to eventual death. FOP is very difficult to diagnose. Children born with the disease appear normal for their first few years. It can easily be mistaken for various types of cancer or aggressive juvenile fibromatosis and fibrous dysplasia. There are very few indicators that doctors can identify at birth in an FOP patient, though one thing that is commonly identifiable is the deformation of the big toe. This indicator can easily be missed at birth and can also be a result of many other genetic disorders. Therefore, doctors will often ignore this symptom when doing a postnatal checkup. Often, the first physical symptom identified is growth of tumor found on the back of the child around age 3. Unfortunately, as the disease is so rare, doctors will attempt to examine and determine the nature of the growth through surgical intervention, which actually worsens and speeds up the disease process. In the majority of cases, there are periods where the production of bone is dormant, but these periods do not last. FOP patients will at some point have what is known as a flare-up. A flare-up can be caused by any number of different things, such as trauma, a broken bone, a bruise, muscle strain, or in some cases a flare-up may occur randomly. During flare-ups, patients will experience swelling, excruciating pain, and loss of body movement as their tissues and muscles harden. Flare-ups can also be triggered if a person becomes ill. Illness compromises the immune system, which accelerates the FOP process. Often parents of children with FOP will prevent their children from being active and try to limit the possibility of being injured in order to slow the process. Treatment for the disease is limited. Medications used to try to limit inflammation and swelling around the muscles are not usually effective. There is no cure for FOP, and people affected often have a life expectancy of 35 to 40 years of age. The disease, which is often referred to as statue disease, leaves the person frozen in a disordered position which limits their ability to eat or bathe themselves. New medications are being researched in an attempt to block or prevent the message being sent from the mutated gene. To date, researchers have been focusing on the ACVR1 gene found on chromosome 2. The ACVR1 is responsible for creating instructions to create a protein, morphogenic protein BMP, type 1 receptors that control the rate and growth of bones and muscle. In FOP patients, only one letter of the 6 billion DNA sequence letters is mutated. As stated by researchers, the ACVR1 protein is 509 amino acids long, and in FOP, the amino acid histidine is substituted for the amino acid arginine at amino acid position 206 in all affected individuals. The formation or ossification of bone is a gradual process. Researchers believe that people with FOP have a mutation in the ACVR1 which changes the receptors and leaving it constantly activated, causing an overgrowth of bone. The disease is known as an inherited autosomal dominant, which means that only a single copy from one parent of the mutated gene will result in a child with FOP. As a result of the disorder being genetically passed, there is no way to isolate it, and treatment is rarely effective. This is especially true in the case of surgery, because although the newly formed bones and cartilage can be removed, it puts the patient at a risk of another flare-up, as they are often caused by trauma. This means that the removed bone would grow back and possibly restrain the patient even further. The bone would grow back as a result of the genes of an FOP patient telling the cells that they need to calcify to heal. This means that a cure cannot be achieved without genetic alterations. Although genetic technology is being developed that can change the structure and code of a chromosome, for patients who are currently living with FOP, it is not possible to change their genetic makeup, as it would require every cell in their body to be altered. At this point in time, there is no cure for FOP, and it will likely take many years to develop one. However, doctors have found that muscle relaxants and painkillers are helpful during flare-up periods to lessen the effects on the patient. Thank you for watching. I hope you enjoyed my presentation of Fibrodysplasia ossificans progressiva.